This is Average Joe PT, where we're here to reduce anxiety, improve function, and master your pain. Ain't that right, Scully?
Mastering
That's
your pain.
right, and today we're going to talk about good old neck stiffness. Oh yeah, you can't get rid of it, gives you a headache sometimes. That's right. Now, Scully and I, we bring content once or twice a week, and we'd love to have you as a part of our family and subscribe down below and hit the call bell so you guys can get our content. But today we're going to talk about three main causes of that neck stiffness and different treatments that you can do at home to help master that good old neck stiffness. Now, ain't that right, Scully? Oh, you're going to be quiet now, Scully? Oh man, don't start lighting that. No. Oh, he's going to light it up. Ah, he's lighting. Oh my gosh. Pretty intense. Here we go. The three main treatments and the three causes we're going to go over. Cause number one, stress. Stress. People get it in their neck and they get it in their lower back and get it in both. Now I'm going to put a pin here. You see those muscles right there? That's right. Those muscles right there can all get really tight and short, you know, when you get all tensed up. And so when you're all tensed up, no blood flow can get in and out of those muscles. Now those muscles are alive. They build up toxins like everything else does when it's using up energy. If you don't get those toxins out of your body, those metabolic types of processes can't work properly. They kind of build up inside the muscle, and all of a sudden you're starting to get some stiffness, you're getting some pain because it's something as simple as stress. Blood flow is number one. You're going to see a trend here in a second. Now, number two is posture. You're all crinked up all the time. You're kind of rounded over. You got these big rounded barrel-chested shoulders. Now, those tissue is always over elongated. Stress is always shortened. Posture, always elongated. So whether something's over length, all right, the blood can't get in and out, or if it's too short, the blood can't get in and out. As you can see, there's a trend. More blood flow, less pain you'll probably have, and less stiffness you'll have in the neck area. Number three, trauma. You have a car crash, you get whiplash, fall. Now, those are tears. That's when you actually see the muscles tear. I'm going to show a pic right up here. I'm going to show you where those fibers that get disorganized. Get scar tissue in there, and they got to get those things reorganized again, and so that you get this nice gliding motion going on. Ain't that right, Scully?
I wish I had some muscles I could work
You
on.
wish you had some muscles, don't you? You'd probably move his mouth a little bit better if he had some. That's number three. Now, there's other reasons and ways, causes of also having some neck stiffness or pain. But these are the three main ones that most people have. Now, you could have fibromyalgia, you can have osteoarthritis or rheumatoid arthritis affecting the joint and give you that stiffness. That's true. You could have some sort of spasms coming from maybe you've had a stroke or traumatic brain injury or some other neurological disorder going on. Those types of problems, some of these treatments that we're going to go over today actually can help at least mitigate or manage those types of pain symptoms, so you guys can at least stick around for that. But these are the three main things we're going to go over: stress, posture, trauma. Treatments are coming. Stick around. I'm going to fly through these treatments pretty quick because I'm going to leave some links down below and ping you up around here, some different cards that go over a lot of these different treatment techniques and other videos I've gone over. Treatment technique number one, obviously, is the Thercane. I've talked about this before. And we're talking about in the neck. We want to hit right up in this area, right up in that area, right where those muscles I showed you before are. Applying that pressure down through it, holding 30 seconds to a minute and relaxing. And you can even hold up to about 2 to 3 minutes until you feel that muscle group release. Simple Thercane. I'll go ahead and leave a link down below. I think you can get them picked up for $8 to $10. You don't want to go that route, you always go good old tennis ball. Tennis ball, you can go ahead and do the exact same thing. You're just going to put it against the surface that you're on, just roll it back and forth. Make sure that you have a solid surface that you can go against with this ball so it doesn't fly out. But that's a simple technique, manual massage that you can do. Technique number two, go ahead and pick yourself up one of these nice little hot pack things. This thing's basically electric, got a little magnet on it. I'm going to leave a link down below to pick up one of these. It's got all types of things, low, medium, high on it. And this one has a shut off so you can be sure that you're not going to light your house on fire like this Scully guy likes to do all the time, or burn yourself. So it just has a nice shut off on it. So I'll leave a link down below for that one. Now we got good old 10s unit. This one I've seen pretty cheap. We're talking these used to be $700-800. I've seen these as cheap on Amazon for about 15 to 20 bucks. I'll leave a link down below for that. Now I've shown in another video. I'm gonna leave this under my cervical or my neck playlist. Goes over in detail how you want to use this one. This is really nice. It hits you multiple spots in your neck, down by your shoulder blades, as well as up by the base of the skull. This is a really nice treatment. I use this myself sometimes. The last one is good old tape. Now this tape you use when you're over a posture, if you feel like you're just kind of rounded a lot. Because what you want to do is put a piece of tape here, a piece of tape on the other side, and you want to pull yourself straight back. So you're almost like in a letter X. Just get a family member. This is Leuko Tape, $8 or $9 on the internet. You can get a whole load of it. Last but not least, I'm going to give you what you can do is some stretch. This you're going to do for all three. Now for the micro trauma one, you'll want to wait until at least 2 weeks have gone by, because those were tears. You want to make sure that those tears have healed up a little bit. Start doing these 3 stretches I'm going to show you right now. Stretch number 1, you're just coming to the side, ear to opposite shoulder, and you want to put just finger pressure. You're not cranking on this, just light finger pressure. You're holding for 30 seconds to a minute and then relax, and then you rinse and do the opposite side. Now you can always put your hand underneath so that you don't shrug your shoulder up, and you can really get some nice elongation there too. That's stretch number 1. Number 2 is you're gonna turn your head and then drop your chin to your collarbone and apply just that light little pressure over the top, 30 seconds to a minute. And then you switch and do the exact same thing to the opposite side, 30 seconds to a minute. And then the last but not least you're going to do is you're going to go ahead and pull straight back, hold for 30 seconds to a minute, and then relax forwards. You're not looking down, you're actually pulling back into what we call a chin tuck position. That'll get the base of the skull muscles, as well as you're getting these muscles on the side, your scalenes, and then also you're getting your levator scapula and your upper trap muscle. Now I'm going to give you one caveat. I'll give you bonus number 4, sternocleidomastoid. Muscle runs from the back of the ear, runs all the way down in your collarbone. It's the 2 muscles that kind of split and make up one on either side. One goes to your collarbone, the other one goes to your sternum. You're going to tilt your head and drop back. That's where you're going to feel the pull along the back side and then for the front of the neck. And then you're going to switch and do the exact same thing on the other side. You get a nice pull through that collarbone and through that ear area. Now 30 seconds to a minute. You're going to do 2 or 3 of those on each side. There you go. All the stretches that you need for your neck. Here we go. Stay tuned. Scully and I want you guys to hit this next tag up here. It's going to go over all types of different chronic type pain treatments that you can do at home. Now, if you're not a subscriber, Scully and I would love to have you subscribe and hit the call bell down below. We bring content once or twice a week, don't we, Scully?
Once or twice a week.
That's right. Until next time, we want you to look up and keep smiling. See you next time, folks.